why our gut is so important, how many diseases and disorders are related to gastrointestinal health.
One of the key underlying reasons why the gut is so important is because
welcome, Dr. Ruscio, to the Keto Diet Solution Summit. It's really an honor to have you here to talk about the best strategies to heal our second brain, which is the gut. But maybe first you want to tell us a little bit more about your personal health journey and your practice.
Sure. Well, thank you for having me. It's always a pleasure to share information about how powerful the gut is in impacting pretty much every facet of our health in a greater or lesser extent. And my personal journey starts with learning some of those things the hard way. When I was in college and I was planning on going into medicine, I became quite ill. I didn't really realize why at the time, but I started having insomnia that was quite debilitating. And waking up 10, 15 times a night, very difficult to fall back to sleep. Torturous level insomnia, brain fog during the day, fatigue, bouts of depression, and eventually this snowballed into food reactive brain fog, where the brain fog was getting even worse depending on what I would eat. And if there were times when I had to be really mentally sharp, I wouldn't even eat because I didn't want to risk a reaction. And this was a very big departure from how I was feeling previously, which was generally pretty well. And I later came to find out that there was an intestinal infection at the root of all this. And this even eluded 3 of my conventional doctors, which also taught me that these gut imbalances go overlooked quite often. And it wasn't until I treated the underlying issue, the issue in my intestines, that I saw a resolution of the brain fog, of the fatigue, of the bouts of depression, of the insomnia, thankfully. And that led me to go into integrative and alternative medicine with a focus on digestive disorders. That's what I do now in my clinical practice. And that's also the area I focus on with the research that I publish that's been published now to date into 2 different peer-reviewed journals. And really just trying to bring people awareness of, again, how important the gut is and the simple things that one can do to heal your gut. The solutions on the internet are sometimes a little bit confusing, but fortunately, if you've been doing this long enough, there's some really simple solutions that can provide people with quite a bit of relief. So that's kind of the long short of it.
Yes, so you are the author of the book Healthy Gut, Healthy You, where people can find a lot of information about it. But maybe first we want to start telling the story why our gut is so important, how many diseases and disorders are related to gastrointestinal health.
Yeah, it's a fantastic question. One of the key underlying reasons why the gut is so important is because arguably your intestines are the primary source of inflammation in your body. And this is because in the small intestine specifically is where we harbor the highest density of immune cells in the entire body. And why that's relevant is because when there is something that triggers the immune system, that causes an inflammatory response. The immune system uses inflammation to combat things that it doesn't want to have present. So one of the main sources of inflammation is an overzealous immune system, and we have the largest density of immune cells in the small intestine, where the small intestine lets some things through and keeps some things out. But when there's dysfunction there, you can have leaky gut where too much gets through because of damage to the gut lining, and that can cause the immune system to react with inflammation. And that inflammation can go systemically, meaning that inflammation can end up causing joint pain by getting into the joints, causing acne by getting into the skin, causing brain fog or fatigue by getting into the brain. And so this is one key component. There's another, which is 90-ish% of your caloric absorption also occurs in that same area in the small intestine. So the entire gut's important. A lot of the importance hinges around the small intestine, and this can manifest in nutrient deficiencies and malabsorption of nutrients, and in this overzealous inflammation, which can manifest literally from everything from your skin to your brain.
So for a person that is not really familiar with gastrointestinal permeability, leaky gut, which would be the main signs that the gut is in trouble, and which are the best ways to test it?
Yeah, so this is a key question, and this is both the gift and the challenging aspect of gut health, because the challenge is that there's not one symptom, but the gift is that many symptoms might actually be driven by a problem in the gut. Now, there's some basics. If you have abdominal pain, bloating, reflux, diarrhea, constipation, all those are fairly obvious indicators that you have an imbalance in the gut. However, there are some people, and this is now being documented in the peer-reviewed literature, that will have digestive imbalances or digestive inflammation, using a loose term, a problem in the gut that only manifests as brain fog, as depression, as insomnia, as joint pain, as skin conditions, sometimes known as atopic dermatitis. And so that's where it's challenging, where there are some cases of digestive dysfunction that only manifest in the brain, in the skin, in the joints. And so there's not necessarily a constellation of symptoms that would say, hey, you've got a problem with the gut. So what I'd recommend people do is more so work through this via a process of elimination. Start with healthy diet and living basics. Avoid processed food, eat whole fresh foods, cook at home as much as you can, opt for healthy, unadulterated foods, get enough sleep, exercise, get some time outside. That's your step one. If after that you're still struggling with various health ailments, the next thing that is a very intelligent thing to consider is making some steps to improve your gut health. Because remember, even if you only have joint pain and fatigue, the cause might be a silent issue in the gut.
So in your book, actually, you talk about the 8-action plan to heal the gut. I guess those are the next steps in order to improve digestive health. So could you describe a little bit more about those steps?
Yes, and just briefly to the other part of your question regarding how do you test leaky gut, there are tests available. However, they're not fully accurate. And this is one area that's challenging is lab testing. And lab testing can be informative, but unfortunately, leaky gut testing isn't fully accurate. It's accurate some of the time. And so rather than trying to quantify and test leaky gut to then only say, well, now I've got to do these things to fix my gut, it's usually a better and more efficient path just to go right into taking these steps to improve your gut health, which does bring us to the action plan that I lay out in Healthy Gut, Healthy You, which is a guide to help people navigate. Okay, I've read low carb, Mediterranean, keto, paleo, probiotics, prebiotics, fiber, oxalates, antimicrobial herbs, elemental diet. There's so much that the consumer is confronted with. And if you know how to use these tools in the appropriate sequence and the appropriate method, then the result you can obtain can be quite dramatic. And I don't say that lightly. We've had a number of readers of Healthy Gut, Healthy You who've been to numerous doctors, and even the doctors weren't able to fix their problems, and the gut protocol in Healthy Gut, Healthy You was able to. So I really want people to know that if you're struggling with maybe working with a healthcare provider because of the cost restriction, this is a good option for you. Healthy Gut, Healthy You is a good option for you to really give you a step-by-step plan to improve your gut health. And the first step would be diet and lifestyle. And I'm not sure if the audience has heard much about a traditional elimination diet. This is where you would cut out grains, dairy, soy, gluten, processed foods. And that elimination diet is a great first step, but it doesn't work for everyone. And some people may even say, oh gosh, I went through all this trouble to eat fresh eggs and meats and fish and protein and vegetables and fruits, but I feel like maybe I even feel worse. And this is where a low FODMAP diet comes in, which modifies the diet in such a way that isn't so counterintuitive. And I can go into more detail about the low FODMAP diet if you like.
Yeah, and actually what you said is very important because it's about the sequence. A lot of people come to the office and say, but Elena, I already take a lot of probiotics and I still have a lot of problems, but it's not about taking tons of probiotics from the beginning if they still need to clean the root cause of what is causing the issue. So the sequence of moving forward into those 8 steps is really crucial. So talking about the dietary theory that is best for healing the gut, which are your thoughts? You were mentioning keto, paleo, your thoughts about grain-free diets for healing the gut.
So what are my thoughts on what the best diet is, or the best?
The best nutritional approach, which one would be for you for healing the gut?
Well, I think they can all work. Now, there's debate regarding should you be higher carb, moderate carb, lower carb. And what I've seen in the clinic, and this is, I think, fairly well bore out in the research literature, any diet in terms of how much carbs you eat or what your macronutrient balance is can work and can be helpful for people. The key thing is to make sure that it's a healthily constructed diet. And this is where we see some of the low carb diets that don't do well or produce favorable outcomes are oftentimes low carb diets that have resorted to unhealthy foods in that diet. And the same thing happens at the other end, where a more higher carb, lower fat diet that produces poor outcomes is usually a diet that is focused around fast foods, processed foods, junk carbs. And the Diet Fits trial by Dr. Christopher Gardner at Stanford, I think, was probably the best study that really showed, hey, if we take two groups of people and one group goes on a healthy low carb diet and the other group goes on a healthy high carb diet, that works well for both of these groups. So I do think it's important to say that, because there's this tendency to vilify one diet as being unhealthy or one being the best. And I mean, certainly food quality is a huge issue, but there's wiggle room within there as long as we're making food quality the primary target that we're striving for. Now, within that, some people will do very poorly on higher carb diets and really flower and respond nicely on a lower carb. And other people will do better on higher carb and not do well on the lower carb. So that can be discerned with a little bit of experimentation. But the first step, irrespective of how much carbohydrate intake you aim for, is removing some of these inflammatory foods, which oftentimes for people can be grains, dairy, gluten, and soy. And if people have done that and still are floundering, that's when going to a low FODMAP diet can next be a very helpful maneuver to make. And this does kind of lead one into a lower carb territory, because the low FODMAP diet restricts a number of different carbohydrates, fruits and vegetables and grains. So I talk about in Healthy Gut, Healthy You, there tends to be this little bit of a pattern where one is first trying to establish what the best diet for them is, and they start in this kind of carbohydrate dip as they cut out some of these FODMAP foods, which kind of naturally leads you into a little bit lower of a carb territory. And then as your gut heals, you don't have to go higher carb, but you at least have the intestinal health to be able to digest these carbohydrate foods that are sometimes problematic for people. And the low FODMAP diet will reduce foods that people oftentimes will say, that I thought was a healthy food: broccoli, asparagus, cauliflower, avocado. These aren't unhealthy foods, but for some people, they really trigger issues in the gut, and most namely, they tend to feed bacteria. And if you have a sensitive gut or imbalances in the gut, that feeding can actually make the situation worse. So this is something, the low FODMAP diet, that can be a short-term kind of dietary experiment to help calm down inflammation, allow the gut to heal, and then you to be able to expand your diet and eat more foods in the longer term.
So could you explain a little bit more what FODMAPs are and how they cause the damage in the gut?
Sure. So FODMAPs are certain structures of carbohydrates that essentially require the assistance of intestinal bacteria to be able to break down and digest. Now, FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, which is just kind of chemistry speak for different structures molecularly of carbohydrates. And it's these FODMAP foods that contain carbohydrates, again, that require bacteria to help us digest them. And so the bacteria get some of that food, and these FODMAPs feed the bacteria. Now, many would claim that feeding intestinal bacteria is good for you. We want to feed our microbiota, feed our gut bugs. And there's a lot that you hear kind of in press nowadays describing how important it is to eat fiber and to eat prebiotics to feed our intestinal bacteria. And to a degree, this is true. But oftentimes what happens, especially when it's the news giving you your healthcare information, is it's one extreme to another extreme, right? It's, fat was bad in the 70s and 80s, and then fat was good, and then fat sometimes is bad again, and now fiber is good, but the pendulum is starting to swing a little bit, where we're realizing that too much fiber can be a problem for some people. And so, again, what I try to do in Healthy Gut, Healthy You is cut through this dichotomous noise and help people understand that while fiber is good, it's not an absolute rule. And what the lower FODMAP diet will do is it will restrict some fibers and some carbohydrates that feed bacteria. So in effect, it will starve bacteria. And that might seem like a bad thing. However, there's a subset of people that have too much bacteria in their small intestines, or they have a bit of inflammation and irritation in their intestines. And so feeding the bacteria causes more gas, causes more metabolism, tends to cause inflammation. And this is where the low FODMAP diet in a number of trials has shown the ability to not only reduce symptoms like fatigue, like joint pain, like bloating, like constipation, like abdominal pain, but also to reduce that leaky gut we talked about earlier and to reduce gut inflammation. So by cutting out some of these seemingly healthy foods, and again, usually in a shorter term application, that allows you to heal, kind of like wearing a knee brace. You wear the knee brace for a little while to heal, and then you can take the knee brace off and run again. Same thing with the low FODMAP diet. It's not necessarily a forever thing, but it helps to calm down inflammation in the gut, allow tissues to heal, and then you can reintroduce these foods in the longer term. And people usually have an ability to tolerate most of these foods when they bring them back into their diet.
So which specific conditions you have seen that they definitely improve when they go in a low FODMAP diet?
Great question. Well, the best research evidence we have here is for various gastrointestinal disorders. So IBS, irritable bowel syndrome, probably the most well-studied. So this is where someone may have constipation, diarrhea, or an oscillation between the two. There might be abdominal pain. There might be bloating. Some cases we'll see reflux also improve from a low FODMAP diet. But it doesn't stop there, because remember we said earlier that these imbalances in the gut can also manifest in the joints, in the skin, in the brain. And this is where the research is a little bit more preliminary, but there is some preliminary research showing a low FODMAP diet can help with fatigue and also in pain. And pain was a fibromyalgia population study where the low FODMAP diet reduced muscular pain as seen in fibromyalgia. So we are seeing more here with the low FODMAP diet being able to help with other conditions. There's also a connection to sleep, where we know that if IBS, irritable bowel syndrome, improves, sleep tends to improve. So while there hasn't been a study yet showing that a low FODMAP diet improves sleep, we know that a low FODMAP diet improves IBS, and improved IBS leads to improved sleep. So there's a number of things that it can help with. We're learning more about what the low FODMAP diet will help with. I would advise someone, if they're thinking that this sounds like something that could help them, try a low FODMAP diet. It only takes about 2 to 3 weeks on the low FODMAP diet to be able to tell if it's helping you. So fortunately, there's not a huge time investment one has to go through in order to see if the low FODMAP diet is a good fit for them.
So actually you mentioned fibromyalgia. My mother suffered from fibromyalgia many years ago. Now she's fibromyalgia free after healing her gut, actually, and
Awesome.
Emotionally. And one of the dietary approaches that she followed for a few weeks was the low FODMAP diet. So, and now she could incorporate FODMAPs back, and she was totally fine, but that was something that really helped her. But in the opposite hand, do you find there are any gastrointestinal conditions that will get worse on a low FODMAP diet based on the type of bacteria overgrowth?
Great question. Some people who have constipation may see a worsening of their constipation when they go on a low FODMAP diet. And what this might look like is someone has constipation, joint, and this is just an arbitrary example, but just to paint the scenario, constipation, joint pain, and bloating. And they may notice that they're more constipated when they go on a low FODMAP diet, but their joint pain and their bloating have improved. And you will see that in some cases. Now, this can happen because on a lower FODMAP diet, people often also end up eating lower fiber, because they reduce their fruits and vegetable intake. You don't have to do that, but what will happen is, let's say, here's the menu of fruits and vegetables Sarah typically eats. Now she has to restrict out FODMAPs. And so she just cuts out some of the menu and she doesn't replace that with other fruits and vegetables. So her total fiber intake goes down. And we know that we need fiber to bulk up the stool to help propel it through and have a bowel movement. So if that does happen to someone, they can just look to incorporate more low FODMAP fruits and vegetables into their diet, or use something like a supplemental magnesium or even a supplemental fiber to help keep them regular. Now, it's a great question that you ask, and it's important for people to realize that not every intervention is going to fix everything. Sometimes you'll see 70% of the situation improve, and then some symptoms are not improving or maybe regress a little bit, and then we have to modify the approach to find the appropriate inputs to the gut to allow that healing to go from maybe 70% of symptoms all the way to 100. And again, that's one of the things I try to codify in Healthy Gut, Healthy You, because unfortunately, it's not always that simple. If one diet fixed everything, then doctors wouldn't be needed. We'd just have a few diet menus and people would be all set. But oftentimes it's a journey where we take some steps forward. There might be a few hurdles. We have to navigate those. But again, with the right approach, having this continual line of progress is usually able to be achieved.
Patience is the key to success, I always say.
Agreed.
And we are our best detectives. We know things, we start experimenting, what works, what doesn't, and then just keep going, because it's about value individuality. As you said, every person's body, every person's gut is completely different. So in order to heal the gut, let's say we go in a low carb diet, low FODMAP diet, how it would really look like? How the typical plate for a low carb, low FODMAP diet looks like?
So probably not terribly different from a normal plate for someone, where I'd recommend they have some source of protein, some source of fat, and then a vegetable and perhaps a fruit. The one change you want to make is you want to look at a FODMAP food list, and these are typically laid out where there's a column of high FODMAP foods to be avoided and a column of low FODMAP foods to be focused on, and engineer the fruits and vegetables on your plate around the lower FODMAP food. So instead of having a big serving of broccoli, perhaps you have some kale, or instead of asparagus, you might have spring greens or green beans. And instead of avocado, you might opt for a different source of fat that is on the lower FODMAP food list. Mm-hmm. So it's not that difficult, but a list really is helpful because there's not a simple rule of thumb like there is with a paleo diet, for example. With a paleo diet, you can tell someone if you couldn't hunt it, fish it, farm it, or forage it, then don't eat it. And okay, that can get you pretty much in the realm. But with low FODMAP, there's no rhyme or reason to it necessarily, unless you're a chemist and you understand the chemistry of all these foods. What would tell you superficially that broccoli is not good, but spring greens are good? You really need that list. But hopefully that one example helps. And then just again, looking at your plate in the context of, okay, we want to have a fat source, a protein source, and a carbohydrate source, and it's mainly the carbs, the fruits and the vegetables, and depending on if you're eating much starch, the starchy carbs, that you want to guide by the low FODMAP section of the list.
And at the end, it's about experimenting, as you said, because some people may be sensitive to certain FODMAPs, but not others. That could be the case.
Mm-hmm. And this is why it's a good general procedure to start with a bit more of a strict adherence to the low FODMAP diet. So really kind of focus in on the low FODMAP section of the list. Give that 2 to 3 week evaluation period we touched on earlier. And then when you feel ready, start bringing some of those foods back in. And most people will notice that a number of foods are fine. They may notice a few foods are really strong triggers. And then some foods they can do, but if they do too much of it, they have a reaction. And that usually improves a number of months later. So if you try a reintroduction, let's say at 6 weeks in, you can try another reintroduction at 2 months in or 3 months in, a little bit later down the line, and you may notice that you're even more tolerant. Because remember, the gut will continue to heal over time. So if you went low FODMAP and you saw a number of symptoms improve, then you reintroduce and you notice you're a little bit sensitive, don't go to forever with that, because there's a good chance another 2, 3, or 4 months later, those foods that you were sensitive to, you'll now be able to tolerate.
So then when you start incorporating one type of food at a time, how fast can you really recognize any symptoms, if you react to it again or not?
Yeah, great question. Most reactions will occur within 30 minutes to about 3 hours. Some people can have a delayed reaction where the symptom may not pop up until the next day. But again, most people within 30 minutes to 3 hours may notice, ooh, I'm feeling a little bit bloated, or I'm feeling some reflux. It's sometimes the symptoms that work their way out, manifest in the skin, manifest in the joints, that may take until the next day to fully kind of pop up. So this is where you want to be a bit methodical, where I wouldn't say it's a good idea to reintroduce 10 new foods all at once, because then if you do have a reaction, which one of the 10 was it, of course? So try to be a bit methodical, where as you're bringing these new foods in, try to make it only 1 or 2 at a time so you can get a read. And then once you've made a judgment on a food, move on to the next.
So now that we eliminate all the triggers, we work on a low FODMAP diet, we are ready to rebalance the microbes in our gut. So we talk about probiotic, a very important part of it in order to bring the inner ecosystem back. So how do you choose a good probiotic? Because there are tons of probiotics out there. So how do you choose a good one? And if it depends on different factors, maybe where you live, your diet, how do you do that?
Yeah, but fortunately, choosing a good probiotic isn't that complicated if you have a good understanding of the probiotic literature. And when you look at the studies that have been performed with probiotics, the probiotics can usually be organized into what I term as one of 3 categories. And these categories are a lactobacillus and bifidobacterium predominated strain. This is something like VSL3, or the one that we use is called lactobifidal blend. And again, you'll see, if you look at the label, you'll see a number of different lactobacillus, like Lactobacillus acidophilus, and bifidobacterium, like Bifidobacterium infantis. And there might be about 10 or so total strains. Now, the strains from formula to formula vary a little bit, but that tends to be the general profile of that type of probiotic. Now, there's another different category that's actually not a bacteria, but a fungus. And this is known as Saccharomyces boulardii. And there's a number of trials using just Saccharomyces boulardii, also showing benefit. And then a third category that is sometimes known as a soil-based or a spore-forming probiotic. And the strains you see here are typically bacillus. So Bacillus subtilis, Bacillus clausii, and you'll see anywhere between typically 1 to maybe 5 strains of the Bacillus family. And these are our 3 different types of probiotics. Now, it's important that you look for a company that uses third-party independent testing to verify that if they say there's 100 billion in here, there's actually 100 billion in there. Because in the analyses that have been done, many probiotics, I believe it's over 50%, actually do not meet the label claims. So this is one area where quality is important. Also, third-party independent testing to make sure that the type of strain on the label is actually what's in the probiotic. Sometimes there's a claim to use a strain that's been used in the research, but they're actually not using that same strain. And you may actually have some harmful bacteria in the probiotic. So that's also something you have to be careful about. And in addition to this, something known as GMP, or good manufacturing practices, will ensure that there are sanitary regulations met, temperature regulations met, and just essentially good quality assurance practices in the company that are encompassed in this certification known as GMP. So essentially, you're looking for GMP, or good manufacturing practice certified, and companies that are doing third-party independent testing to verify the actual strains are what they should be, and the potency is what it should be. Now, that sounds kind of like a lot. So if you don't feel you have the training to kind of take that all on yourself, I would look for reputable companies, because most reputable companies will be adhering to that. Now, one of the ways you can figure this out is if you're looking at probiotics and there's one that is far less expensive than all the rest, that tells you corners may be cut. Now, I want to be careful to say it doesn't mean the most expensive probiotic is the best, because sometimes people will take a subpar product and just put a high price tag on it, and some people get fooled into thinking that that means it's the best. But you want to look for, you'll see a clustering in price, and different formulas will maybe be $5 to $10 within each other. So there's this kind of range. If you see anything far to the north or south, I'd be suspicious about that. So that's the quality piece. So either find a company that you know follows those criteria, or a reputable brand that has a good reputation, and you'll most likely satisfy those quality assurance criteria. There's another aspect here in terms of how to use these probiotics, but I guess let me pause for a second before I go into that, in case you want to talk about any of the quality assurance practices.
So yeah, you talk about quality, but then we talk about quantity, I would say, because how many bacteria we have to put in one serving of probiotic, when do we take it, which kind of strains, if it depends on different type of conditions that we go through.
Yes, so for these different probiotics, when you really look at the studies that have been done on these, and I've done this to a painstaking degree, what you see is a general dose range that emerges for each one of these three categories of probiotics. So let's say for the category 1, the lacto-bifido blend type probiotic, there's a certain range that if you look at all the over 100 clinical trials that have been published, you'll have one study that uses this minimal dose, another study that uses this maximal dose. Most of the studies kind of somewhere in between. And so it's safe to say that we have a range, and this is the range that we've listed in our probiotic protocol in the book and also on our website. I can't say that one is best. And so I do believe it's important to give people a range, because some people will notice the lower end of the range improves their symptoms just fine, and there's no need to go higher. Now, if you have someone with a recalcitrant and, let's say, steroid-resistant inflammatory bowel disease, that's a really challenging case, they might really need to go to the upper end of that dose range. So there is a range, and we have some wiggle room. So from a consumer perspective, this is actually kind of nice. This means if the range is, let's say, 2 capsules of a probiotic to be taken 1 to 2 times per day, so 2 capsules 1 to 2 times per day, if you take 1 dose but you forget your second, you're okay, right? There's some wiggle room. So we don't have to be necessarily fanatical about the exact dosage. And with the strains, this I think is a crucial concept for people to understand. There's a lot of marketing claims on the internet that if you have depression, you should use this probiotic. If you have constipation, you need this specific probiotic. And I appreciate what those claims are trying to do, which is be very critical and evidence-based. But unfortunately, I think what's happened is marketers have taken one study showing one probiotic helps with constipation, and they use that one study to say this is the best probiotic for constipation, ignoring the fact there have been 3 other studies with 3 different probiotics also showing the ability to improve constipation. That's not disclosed by the marketer who's trying to market the one probiotic. So the consumer is confronted with company A, B, and C, all claiming that their different formulas are the best for, in this case, let's say constipation. And now the consumer is saying, well, I don't know how to make heads or tails of this. Fortunately, when you look at the probiotic literature, you see for a number of conditions, including joint pain, certainly including IBS or digestive symptoms, also including depression, numerous different types of probiotics have been shown to have the same positive effect. And when you zoom out even further, and you really have a kind of bird's eye view of the literature, you see that it's more likely important to find the right mixture of the 3 probiotics for an individual, rather than saying because of this one study looked at this one probiotic, that's the best probiotic for the condition. So instead of using probiotics like drugs, this is the strain for this symptom, we want to have a person try each one of these 3 different categories of probiotics and personalize those to their gut. And so how this looks, said more simply, is we know that there are 3 categories of probiotics. I would try all 3 formulas. That tends to be the best support for the gut ecosystem. And the analogy I like to use here is picture a stool, like a stool you sit on. If you had a 3-legged stool that was supporting the stool, that would be a very balanced stool. But if you're trying to balance on just one leg, it's very easy to tip over. This is why I think some people see suboptimal results with using just one probiotic, because that one probiotic supports one niche of the gut ecosystem, and that kind of helps, but the gut system can't maintain balance unless we get these 2 other niches supported in there to really help keep the ecosystem balanced. So rather than trying different probiotics for different conditions, we can simplify this and say, okay, instead of trying this probiotic and that probiotic and the other and the other and the other, you have 3 formulas to try. Try those 3. And if you're sensitive, try them one at a time. So in case you do have a reaction, you can easily say, that one caused a reaction. I won't use that one. I'll use the other 2. And really finding the best probiotic for someone's gut can be as easy as that. 3 formulas, category 1, 2, and 3. Find a quality formulation for each one of those. And if you're sensitive, try them one at a time. If you're not sensitive, try all 3 at once. And then you've really given your gut a good trial through probiotics. And if that fixes everything, great. And if not, there's other steps beyond probiotics we can move to.
That was a really good point. Instead of just one bacteria that fix one thing, get a combination of different ones and 3 different formulations to see which one fits that individual. That was a really, really good point. And then we always hear that together with probiotic, we need to have good prebiotic, which is the food for the bacteria. So which is the benefit of prebiotic? What's happening whenever the bacteria is eating the prebiotic?
So prebiotics feed intestinal bacteria, like you said. The probiotic is actually supplying the bacteria. The prebiotic is the food that the bacteria eat. Now, in a low FODMAP diet, we actually reduce the amount of prebiotics in the diet because FODMAPs and prebiotics are kind of the same thing. They're compounds that feed intestinal bacteria. So we have to be a little bit careful with prebiotics. They can help many people, but for some who are really sensitive, they can be problematic. So this is why in the Healthy Gut, Healthy You protocol, for most people, we recommend trying prebiotics a bit more toward the end of the line, because that increases the probability that they will help the person and not flare the person. And this is a key point for the audience to be aware of. The more inflamed and symptomatic your gut is, the more likely you are to have a negative response to prebiotics initially. This is why we start with a low FODMAP diet, which by definition reduces prebiotics in the diet. But then later we expand the diet to include more FODMAPs, and we also consider adding in a prebiotic supplement to feed the bacteria even further. And there are published benefits to using prebiotics. Increased bacterial counts in the gut, and also reduced symptoms of IBS, and improved gut permeability or improved leaky gut. The thing that's somewhat challenging is some people will react to those. So we have to be a little bit more cautious with the people who are very symptomatic, delay these until later. That reduces the probability of any kind of negative reaction and really optimizes for hopefully seeing only benefit from using a prebiotic.
And which specific good prebiotics do you usually recommend?
That's debatable. There's blends of things like inulin, galacto-oligosaccharides, fructo-oligosaccharides. Some prebiotics use only one formula. There was an interesting study using essentially a galacto-oligosaccharide, or known as GOS, called Bimuno with IBS patients that showed favorability. Some people use resistant starch, and some people advise whoppingly high doses of resistant starch, which essentially if you make potatoes or rice, if you cook it and then cool it, you form this resistant starch, meaning it requires bacteria to break it down. That can be helpful for people, but if you read an article telling you to do spoonfuls of resistant starch, I'd be cautious because that can really flare some people, especially if you're sensitive. So there's a number of different prebiotics that are available. We use one called Biota Boost, which is a blend. And I've been experimenting with a few others that are supposed to be better tolerated by IBS patients, but I haven't been using them long enough to be able to say, I've found this one to be more tolerated than others. So I think people have some leeway with different prebiotics that they can try, but it is important to keep that other tip in mind, which is the more symptomatic you are, the longer I would wait before you perform that trial on the prebiotic.
So that would be kind of like the last step in the action plan.
Yes. Now, what I like to have people do is try to broaden their diet first and then try the supplemental prebiotic later. The reason for this is most people would rather eat more food than take a pill. Like some people might be saying, I'm dying for some onion, I'm dying for some garlic, I'm dying for some avocado. So what do you want to do first, patient so-and-so? Do you want to bring in some pills or bring in your avocado? So most people would like to do the prebiotics or their foods first. So yeah, that ends up pushing the trial of the prebiotics a little bit later, pretty close to the end of the series of steps one would use to help heal their gut.
And then to finish, I would like to introduce a lifestyle tool that a lot of people, that is very popular now, that is intermittent fasting. Because besides talking about food, which is always the foundation for a healthy gut, we have to introduce certain tools in our lifestyle that helps improving gut health. So which are your thoughts about intermittent fasting for proper gut health?
Intermittent fasting is a very helpful tool for many a patient, and there have been some exciting studies in both IBS, irritable bowel syndrome, and in IBD, inflammatory bowel disease, showing that intermittent fasting can improve digestive symptoms. There's also metabolic benefits to intermittent fasting. And essentially what this can also be termed as is your meal frequency. Are you someone who eats frequent meals every 3 to 5 hours? Or do you maybe go a stretch of 8, 10, 12, 14 hours without food? And there's no right or wrong answer here. A lot of people would really benefit from a degree of intermittent fasting. They may notice, oftentimes for patients, I recommend 1 to 2 days per week, go 14 to 18 hours without food. That tends to be a good window, especially if you go 18. That's a fairly good window. The other thing to keep in mind there is some people, especially if they've had a lot of illness, a lot of symptoms, a lot of stress, they may not have the vitality to be successful with intermittent fasting, or they may have to very cautiously work up to longer windows. If they try to go right to 18, they will feel hungry, they will feel foggy, they will feel irritable. So I just want to paint that caveat because it can be health promoting, but some people need to wait a little while before they do that or be very slow in how they build up to it. That being said, fasting clearly can be beneficial for the gut. And the analogy I like to use is that if you had a sprained ankle and you were running 3 times a day on it, it'd be hard to heal. If you have an inflamed gut and you're eating 3 meals a day, it can be hard for the gut to heal. So one of the things we can use fasting for is a tool to give your digestive system a break so that it can heal. And this can be quite beneficial for patients with digestive maladies. So yes, I would definitely recommend some experimentation with fasting. And this is something that I wrote into step 1, along with the dietary tips in Healthy Gut, Healthy You, which is finding the best meal frequency for the individual.
But you mentioned that some people may have to wait to do intermittent fasting, because I also find a lot of people, when they start from day one making dietary changes and introducing intermittent fasting, they get constipated, more constipated than usual because they are not putting enough food in the body. So what do you think is that? Why do you think intermittent fasting could be prone for constipation?
Yeah, I don't get so concerned if someone's intermittent fasting and they're a bit constipated, because there's less food going into the system. And so it wouldn't be a strange thing to see. And we see the same thing when patients or readers of ours use an elemental diet, like the Elemental Heal formula that we've made, where essentially you have a liquid nutrition, a meal replacement shake. And some patients will do this for days on end exclusively. And they get concerned because they're not really having bowel movements. But in this case, there's not really any roughage to come out the other side. Same thing kind of applies for intermittent fasting. There's less roughage. Also, there's something known as the gastrocolic reflex, where when we eat food, that can stimulate all the way down the line in the colon, the muscles to contract, and you have a bowel movement. This is why some people will notice, boy, I ate lunch, and then I had to go to the bathroom. It's not that the food you just ate is coming out the other side. It's that it's stimulating at the very end of your GI tract this reflex that propels the stool. So it could also be a diminishment of that reflex that tells your colon to push the feces out.
That was a really good point. So everybody should start anyway trying to experiment with intermittent fasting for optimal gut health. So if you would like to summarize or maybe share the last message for the audience, whoever is out there suffering from any disorder related to the gut, which one would it be?
Yeah. I mean, I'd love to. The point I'd like to leave people with is you really have more power over your health than you may think. And I understand it can be quite confusing. As someone who had my own health ailments and I went to the internet to find solutions, it was very confusing. It was overwhelming. And I know how challenging that can be. If you have a good guide and a good roadmap, which is really what I tried to create with the book, Healthy Gut, Healthy You, and you simply follow that, it can be quite remarkable the improvements that you can see. And while I get, we're all looking for kind of a quick fix, and you might start reading a book and then you see some podcast or blog post that really resonates with you and you want to jump ship from the plan. Whether you use Healthy Gut, Healthy You or another resource, try to find a trusted resource that will give you an all-encompassing plan and work through that. If you take things one step at a time, if you listen to your body and you're confident in the fact that you have a good plan you're working through, you can really take control of your health and make strides in how you're feeling. It's just needing to kind of hone our focus and not get distracted by the wealth of information that's always coming at us, that's needed in order to commit you to a path and a course. And it's not always quick. It's not always easy. Sometimes we take 3 steps forward and 1 step back. And when you're having that backslide, you get discouraged, you want to give up, you want to quit, you want to do something else. But try to have a long-term view on this and be patient. And I think you'll be amazed at how much improvement you can see by doing that.
Thank you very much for that message, for the hope. And as you said, it's very important where people go to find information, because there are a lot of things out there. So thank you very much for all the training in Low FODMAP Diet, in probiotic, and all the content that you create to help us every day having a healthier gut and a healthier lifestyle. Thank you so much.
My pleasure. Thank you.